Hi, my name is Neely Siegel. I'm going to be doing a head-to-toe assessment on Yoav Kfir. He already signed the consent. I'm going to call him in. Yoav, come. Hi, I'm Neely. I'm going to be your provider today. We're going to be doing a head-to-toe assessment. Do you have any questions?
No.
Okay, you can have a seat. And then bring your chair and I'll go towards mine so I can see you. Okay, there we go. Okay, can you tell me your first and last name?
Yoav Kfir,
And your date of birth?
September 13, 1987.
Okay, and do you know where you are today?
Yeah,
Where are you?
new practice.
Okay, and what are we going to be doing?
Assessment.
Okay, and who is the President of the United States?
Joe Biden.
Okay, so I already saw when the patient walked in that his gait was stable, no extra movements, it was nice and smooth. His posture is erect. He's alert and oriented times 3. His affect is appropriate for the situation. He's well groomed. He's dressed appropriate for the situation. And when I shook his hand, I felt that his skin was warm, dry, and intact, and his nail beds were well groomed and nice. Okay, so I'm going to start by palpating your head. Okay, I don't feel any masses. Just going to take a look at your hair. In the back also. I don't see any signs of abnormal balding, no infestations or lesions. Looking behind the ears for any dryness. Okay. Head is normal cephalic. Eyes are in line with the ears and symmetrical. Hair is evenly distributed in the eyebrows. Okay. I'm just going to palpate your temporal arteries. Okay, +2. Can you just clench your jaw for me? Okay, open and close your mouth. I don't feel any clicking or scraping of the teeth. Can you squeeze your eyes as tight as you can? Okay, relax. Puff out your cheeks. Okay, stick out your tongue from side to side. Okay, push against. There we go. Okay, testing cranial nerves 5 and 7. All right, I'm going to take a look at your eyes. Okay. Sclera is white. The bulbar conjunctiva is light pink and moist. Eyelashes are evenly distributed. Focus on my nose. I'm going to flash a light, okay? Looking at my nose, I'm going to do it again. Looking at the opposite eye this time, so you're going to focus on me. Watching the pupils constrict in the opposite eyes for consensual. Okay, so pupils are equal, round, and reactive to light. Checking for accommodation, you're going to focus on the pen light. As I move it closer to your eyes, I'm going to be looking at your pupils and watching them constrict. Okay, eyes accommodate. Take a look inside your eye. I was checking the optic disc, which was an orangish pinkish color, round and oval with demarcated margins. Retinal vessels were intact. The retina was a light pink, and macula was present without any degeneration. Okay. I'm going to check your optic nerve, cranial nerve number 2 with visual acuity. I'm standing 20 feet away. Can you read the bottom line? Can you read this bottom line?
LTFPH.
Okay, can you cover your left eye when you read it? Can you read it again?
LTFPH.
Okay, can you cover the opposite eye? And read the same line.
LTFPH.
Okay, so vision is 20/20 in the left and right eye. I'm gonna come around you. Checking your peripheral vision, can you cover your left eye? Tell me when you see my fingers.
No. No.
Okay, cover the opposite eye. Tell me when you see my fingers.
No. No.
Okay, good job. Okay. check your nose now. Have you had any sinus issues recently? Okay. Looking at the turbinates, and I don't see any polyps, any drainage or discharge. Can you close your eyes for me and occlude your left nair? Cover your left nair, your nose, your nostril. Smell this. What do you smell?
Cinnamon.
Okay, cover the other nostril.
Cinnamon.
Okay, testing cranial nerve number 1, olfactory nerve is intact. Okay. See this pen light? I'm gonna test cranial nerves number 3, 4, and 6. You're gonna follow the pen light just with your eyes, don't move your head. Okay, cranial nerves number 3, 4, and 6 are intact. Okay, let me know if you feel any tenderness as I palpate your sinuses, your frontal and your maxillary sinuses. Any tenderness? Okay, none noted. All right. I'm gonna check your mouth. Oral mucosa is nice and pink. I don't see any broken teeth, bleeding gums, any type of ulcers. Checking the soft palate and the hard palate, and on the sides of the tongues. I don't see any signs of ulcers or wounds. Can you stick out your tongue? Say ah. Okay, the uvula is midline and rises with the soft palate. Tonsils are +1. Can you just swallow for me? Palpating the thyroid. The thyroid was nice and smooth. And I checked your gag reflex right now. Can you stick your tongue out? Gag reflex is intact. Okay, so push your tongue against my cheek. Against my hand. Press your tongue. Okay, there you go. And stick out your tongue again, like earlier, and do side to side. Okay, so we tested cranial nerve number 9, 10, and 12. Next, I'm going to palpate your ears. Let me know if you feel any tenderness against the pinna and the tragus. Any tenderness? Okay. Just gonna inspect the ear. Okay, so far no signs of any drainage. I'm on the right side. I'm gonna pull the pinna up and back. And looking at the tympanic membrane, is pearly gray with the cone of light at 5. The left ear, no signs of any drainage or discharge. Tympanic membrane is pearly gray with the cone of light at 7. Okay, I'm gonna check cranial nerve number 8, hearing. Can you cover your left ear? I'm gonna whisper something into the opposite ear. Tell me what you hear.
1.
Okay, cover the other ear.
Apple.
Okay, great. Cranial nerve number 8 is intact. I'm just gonna do the Weber test. I'm gonna hit this tuning fork. You're gonna hear a sound. Let me know if you hear it in both ears or just the left or right.
Both.
Okay, great. Okay. I'm just gonna assess your lymph nodes. Preauricular, postauricular, occipital, tonsillar and submental and submandibular, anterior cervical, posterior cervical, and supraclavicular lymph nodes. No tenderness noted, non-palpable, and no swelling. Okay. While I'm here, I'm just gonna check for your trachea. Trachea is midline. Can you shrug your shoulders against my hands? Okay, thank you. Turn your head towards this hand against resistance, opposite side. Spinal nerve number 11, cranial nerve number 11, spinal accessory nerve is intact. Okay, can you stand up, please? Okay. I'm just checking for upper extremities. Skin is intact, no signs of any wounds, lesions. Warm and dry to the touch, checking tenting for skin elasticity, looking at your hands. No signs of any clubbing. Cap refill is less than 3 seconds. Checking the joints for movement. Good movement. Can you keep your eyes closed? Arms at your side, feet together. Okay, no swaying noted. Romberg test is negative. Open your eyes up and bring your arms out in front of you. Close them. Okay, no drifting noted. Open them up. Well, you can just bring your arms up to the side like this. Back down, above your head. Okay, good range of motion. You put them down. And then we'll just do your strength while we're here. Can you push against my hands? Okay. Hold my hands towards you. Okay, strength is a +5. Squeeze my hands. Okay, very nice. Okay, you can, actually we'll do that in a second. Let me check your back first. Let's do the carotid sections. Okay. I'm just inspecting your back. Everything looks symmetrical. Can you take a nice deep breath for me? Lung expansion is symmetrical. Just checking the skin while I'm here, and no signs of any lesions, wounds, hairs evenly distributed on your back. As I palpate, I don't feel any masses. Musculature feels even. Percussing. Listening for resonance. I'm going to have you say 99 every time you feel the ulnar surfaces of my hand, checking for tactile fremitus.
99, 99, 99, 99, 99.
Okay, very nice. Just going to listen to your lungs. Just take nice deep breaths. Can you say E every time you feel the stethoscope?
E, 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 E.
Okay, I was just checking for egophony. I'm going to look at the front. Okay, everything looks symmetrical. No signs of any palpitations anywhere. As I palpate, I don't feel any signs of masses. Percuss. Okay, resonance heard. I'm going to have you say 99 again for tactile fremitus.
99, 99, 99, 99.
Okay. I'm going to take a listen to the front. Every time you feel the stethoscope, can you say E?
E, 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 E.
Okay, very nice. Okay, the last thing I'm going to do is just check your pulses over here, your brachial. +2, radial pulses are +2. Wait, can you have a seat over here? Lay your head back. Just going to palpate your carotid. One at a time. 2+. Looking for any signs of JVD on the right side. I don't see any jugular vein distension. I'm going to listen for a Berube in the carotid. No Berube. Okay, I'm just going to take a listen to your heart in all 5 areas. Starting in the aortic, pulmonic, Erb's point, tricuspid, and the mitral for the maximal pulse. S1, S2 heard. I'm gonna listen again with the bell of my stethoscope for any murmurs or abnormal heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. No murmurs or any abnormal heart sounds present. Okay, I'm just going to inspect the abdomen. I don't see any pulsations coming from the abdominal aorta. I don't see any signs of inguinal hernias or umbilical hernias or any type of masses. The visual lesions, any skin disorders, and the stomach is flat. Okay? You can put your head down, relax. Just gonna take a listen. Starting with the abdominal aorta, listening for any bruits. The left renal artery, the right renal artery, the right iliac artery, the left iliac artery. Listening for vowel sounds, starting with the right lower quadrant. Normal active vowel sounds in all 4 quadrants. It's going to percuss. Tympani heard in all 4 quadrants. Do you have any tenderness when I do this?
No.
Lightly palpating your abdomen?
No.
And do deep palpation. No masses. Bell, palpated. I don't palpate. I'm looking at the spleen and the liver and they are non-palpable. I'm going to check your femoral pulses. Okay, looking at the legs, I see the hair is evenly distributed, no signs of edema or any type of discoloration in the skin from any vascular disorders. I'm just going to feel your popliteal pulses. Okay. Your posterior tibialis. And dorsalis pedis pulses. I see the toes, the nail beds, no signs of any fungus, they look well groomed. Can you flex your feet against my hands? Okay, now push against my hands. Strength is a 5. Okay, I'm just going to check your reflexes while you're here. Starting with the patellar. Achilles. And the plantar. Okay, you can stand up for me now. I'm just gonna finish your reflexes, starting with your tricep. Your bicep and your radius. Checking with your tricep, your bicep. Okay. Okay, can you touch your toes, please? I'm looking at your spine. At the curvature, no signs of any scoliosis. Spine is midline. You can stand up for me. Okay.
That's it?
Thank you. Thank you for your time. Do you have any questions for me?
No.
Okay, it's nice meeting you.
You too.
Okay. Okay, that concludes my head to toe assessment. Thank you.